Let's now talk about pericardium 4, or the Xi-Cleft gate point, and accumulation, or Xi-Cleft point. Pericardium 4 is located 5 Chun proximal to the anterior space of the wrist joint, most distal wrist crease, between the tendons of the palmaris longus and the flexor carpi radialis muscles. How to find pericardium 4? Using the spreading hands technique, place the little fingers in the center of the anterior wrist joint space and at the level of pericardium 7 and the cubital crease respectively at pericardium 3. From the midpoint of this distance, measure 1 Chun in a distal direction. On this level, locate pericardium 4 between the two tendons, which become more pronounced when the fingertips are pressed together. If only one tendon is visible, this will be the tendon of the flexor carpi radialis muscle. Pericardium 4 is located on its ulnar aspect. Pericardium 4 is needled 0.5 to 1 Chun vertically or 1 to 1.5 Chun obliquely in a proximal direction. For its actions and indications, pericardium 4 tonifies the blood, dispels blood stasis. It calms the Shen, cools the blood, and opens the channel. For its special features, it is the Xi-Cleft point of the pericardium channel. It is a major point for acute, painful blood stasis in the region of the thorax and the heart. Pericardium 4 is an important point of the pericardium channel, and being the accumulation point, it is used in acute conditions, particularly to stop pain. It has an influence on the chest and stops chest pain. Being the accumulation point, it is the best point to use for painful and especially acute painful conditions of the channel. Pericardium 4 has a special action in calming the heart and regulating its rhythm, so it is the point of choice to use for arrhythmia and palpitations. It also invigorates blood and eliminates stasis, especially in the chest, so that it is a very important point to use for chest pain due to stasis or of heart blood. It also cools blood and can be used for skin diseases caused by blood heat. Finally, pericardium 4 strengthens the mind in cases of heart deficiency, which may give rise to fear, anxiety, insomnia, and depression. In summary of its functions, pericardium 4 invigorates blood and eliminates stasis, like in chest pain and heart pain. It cools blood and stops bleeding, as in the cases of coughing of blood, vomiting of blood, and nosebleed. It also calms the mind for agitation, anxiety, insomnia, mental restlessness, depression, and fright. And it also removes obstructions from the channel and stops pain. Pericardium 4 is the Xi-Cleft point of the pericardium channel. The Xi-Cleft points are where the Qi and blood, which flows relatively superficially along the channels from the genial points, gather and plunge more deeply. The Xi-Cleft points in general are indicated in the treatment of acute conditions and pain, but the Xi-Cleft points of the yin channels have an additional action of treating disorders of blood. Pericardium 4 is an important point to treat both acute stasis of blood and heat in the blood. Through its dual actions of invigorating blood and moderating acute conditions, pericardium 4 is a primary point for treating stagnation of blood in the chest and heart, giving rise to acute pain which may radiate to the neck, back, or left arm, or be accompanied by vomiting. Its important role in the treatment of heart pain was both emphasized in the classics and is borne out by modern clinical practice and research. By virtue of its ability to clear heat from the blood and stop bleeding, Pericardium 4 is indicated for hot, reckless bleeding in the upper jaw, giving rise to nosebleed and vomiting or coughing of blood. The second principal group of indications for pericardium 4 includes a variety of mental and emotional disorders, such as agitation of the heart, insomnia, melancholy, and fear in frightened people. The relationship between pericardium 4 and emotional disorders is expressed through its effect on the blood and the heart chi. The heart holds the blood and houses the spirit, and there is therefore a reciprocal relationship between blood and disturbance of the spirit. On the one hand, when blood is stagnant and does not flow freely, essential nourishment will not reach the heart, and the heart's function of housing the spirit may be disrupted. On the other hand, emotional disturbance may lead to stagnation of blood. The spiritual pivot states, internally, a person may be injured by worry and anger. When this occurs, the chi will rebel upwards. When the chi rebels, thus the 6 shu points, as the points of the 6 channels, will not flow, the warm chi will not circulate, and internally the congealed blood will coagulate and not scatter. By resolving stasis of blood, pericardium 4 is able to both treat emotional disharmony and to resolve the heart-blood stasis that results from it. Blood stasis in the heart most commonly occurs as a result of deficiency of heart chi and yang. These patterns frequently give rise to feelings of fear, melancholy, and a diminished spirit, typically seen in patients after a myocardial infarct or cardiac surgery, the shock of which may further injure the heart chi. Pericardium 4 is able to regulate heart chi as well as the blood, and is classically indicated for insufficiency of the spirit chi. Finally, there may be symptoms of mental and emotional agitation, as well as hemorrhage, when the heart enters the nutritive or blood levels during febrile disease and rise to disturb the spirit. Thus, the treatise on epidemic warm febrile disease stated, when the nutritive system is invaded by heat, the blood is consumed, the spirit is disturbed, and there is insomnia. Pericardium 4 is able to calm the spirit in such cases by clearing heat from the nutritive and blood levels.